The Tender Medical Committee is made up of quite a number of different people from different backgrounds. Some of those people are involved in acting as the health professionals that actually administer medicines to patients, and some of us are pharmacists. So we have different aspects that we're interested in when it comes to the medicines and the way that they're used, and those viewpoints are represented all around the table. So there's a number of pharmacists on the committee, some of whom are hospital pharmacists, some of them are community pharmacists who own their own business, and so are intimately involved in the actual issues that are at play here. And those viewpoints are all robustly expressed, and we come to some agreement around the benefits and costs of various decisions that we make. But at the end of it all, it's the consumer or the patient that's actually pivotal to the whole decision making. None of this has any value unless we can actually get the right medicine to the right patient in a way that they can actually deal with it.
Being able to provide a pharmacy perspective to PHARMAC, it's our expertise at what happens at the coalface, at the counter, that I bring to PHARMAC, so that I can say this particular thing that we're looking at will or won't work. And no amount of savings of money will be of any value if the customer takes it off me at the counter, walks out the door and literally throws it in the rubbish bin.
MedSafe deals with the actual regulatory aspects of medicines and whether they are of equivalent quality from the medicines perspective. What we're looking at with the Tender Committee is actually the practical aspects of these medicines. We're looking at the packaging, we're looking at how readable the labels are, we're looking about how easy it is to get into that packaging for somebody who might have limited abilities, limited dexterity. We consider all sorts of things about breakability of tablets. We also consider palatability of medicines. I'd admit that not all of them taste fantastic, but sometimes that's unavoidable. It is a factor that we consider and we do take seriously. We sit there with our teaspoons and all try things just to make sure that we do have a good understanding of what the implications are of these decisions that we're making.
Amongst that, of course, is also the ramifications for pharmacy for things like pack sizes, repackaging costs, and the knock-on effects of having to count and pour versus just stick a label on a box, and that's discussed literally every time we have a new medicine, every time without fail, to ensure that this is a practical step that reasonably can be expected for pharmacy to deal with. Sometimes there's some wins and sometimes there's some losses, and it's a bit of an averaging, but at the end of the day we try and ensure that pharmacy is not inconvenienced or financially impacted by the use of various pack sizes.